Chairman, and I want to thank the committee for including my legislation, H.R. 9117, the Clear Healthcare Expense Cost Knowledge, or CHECK Act, as part of today's discussion. The CHECK Act is designed to lift the veil of secrecy surrounding healthcare costs, giving patients clearer information, bringing hidden costs out into the open, and creating better accountability throughout the system. In every other part of our economy, consumers can see prices before making a purchase. When you go to a restaurant, you get a menu. There's prices on it. When you walk through a grocery store, there's prices on every shelf. Healthcare should be no different. There should not be a surprise when you get a letter in the mail a month later. But with that, Ms. Tripoli, for the average patient trying to navigate the healthcare system today, what information is most often missing when they're trying to understand the cost of their care?
I think just that, the cost of their care, their out-of-pocket costs, like what are they actually paying out of pocket, as well as other information about what is the type of care that I'm going to get from this plan when I'm selecting a plan, what are the prior authorization care denial rates, what's the quality of care that I'm going to get, can I see the doctor that I'm currently seeing? I think those are all very challenging data points for consumers to have as they navigate the healthcare system.
Thank you. Too often, patients open a bill and they're left with way more questions than answers. And one of the goals of the CHECK Act is to ensure that patients receive clear explanations of benefits and itemized medical bills so that they can better understand what they're actually being charged for, what their insurance actually covered, and what they owe. Ms. Tripoli, how important is that type of transparency for patients trying to make informed decisions about their care and their finances?
Very important. Having an itemized bill on the back end helps patients to double check, right, with their EOB and what they're being charged. So it is an important tool that consumers can use. But I would say that in and of itself is not going to be sufficient. We still need broader price transparency across the system, unveil prices overall, and to bring down healthcare costs by directly addressing the root drivers of what's driving up premiums in the first place.
Thank you, and I think that's exactly why this matters. When prices remain hidden throughout the system, no matter which leg of the stool within our healthcare system they are, it becomes much harder to understand who is being paid for what services and at what cost. And when healthcare costs go up, every part of the system seems to blame a different leg of the stool. In hospitals, they point to insurers point to hospitals, PBMs point to manufacturers point right back to the PBMs, and maybe everybody's right. Maybe everyone is right, and maybe they're all wrong, but the only way to know is for everyone to flip their cards over, because if no one can follow the money, no one can figure out why the costs are skyrocketing to the level they are. Mr. Grebinger, the CHECK Act includes enforcement provisions intended to help ensure compliance with transparency requirements and provide employers and health plans with access to information that they're entitled to receive. From your perspective, have existing transparency requirements been consistently enforced, and how important is enforcement in ensuring that those requirements produce actually meaningful results?
Thank you for the question. Unfortunately, I think they have not been consistently enforced. As we've seen, only a couple dozen hospitals have been had penalties against them for non-compliance with the hospital price transparency rule. I understand President Trump just suggested that they would fine up to 500 hospitals for lack of compliance. We think that stronger enforcement is necessary, and we very strongly endorse legislation to codify these rules and increase enforcement action.
Well, thank you very much, and I appreciate all of the witnesses' testimony here today and for this discussion, and I want to thank the committee for including my legislation, the CHECK Act, as part of today's hearing. And with that, I will yield back.